and erythrasma can come back. So, if you go through this entire process of doing all this, beautiful care of your feet, what I actually just call routine foot care, if you go through and do all of these things and you don't have any more issues with the skin in between the toes, you're not having any issues with itching or pain or even a cut in between the toes, the the erythrasma will go away, which is beautiful and amazing. But if you go back to the practices of not washing your feet thoroughly, not drying off in between each individual toe, and then go back to putting lotions and creams in between your toes again, that same process will occur. I mean, it's just common. So you'll have some tools in your toolkit to prevent it from happening, or you'll know exactly what to do to stop it from happening again. I'm going to talk to you a little bit later on about those other things that, remember I said it was a killer combo that oftentimes presents with the erythrasma. Remember we talked about toenail fungus, or we talked about foot fungus. We talked about a smelly foot. The smelly foot oftentimes presents with a sweaty foot. And we'll talk about all three of those things. We'll talk about all five of those things actually. Erythrasma is not necessarily going to need any oral antibiotic or any oral antifungus because it's bacterial in nature. It's like thinking about a yeast infection and bacterial vaginosis. Those fungi and bacteria live on our bodies in like perfect harmony, right? There's not too many fungus. It's not too much more fungi than it is bacterium. They all are at the same level. They actually are battling against one another to keep everything steady, everything neutral, everything copacetic, if you will. When any one of those organisms is allowed to have an overgrowth, this is where we have a problem. And so in the case of erythrasma, it is a superficial skin infection from a bacteria.